Here is the muscles of appendicular system. So this is just a different topic that we can start discussing here. You can see a couple of the axial and skeletal muscles are there too. Platysma, sternocleidomastoid. Don't worry about them because we already talked about it. So let's talk about the appendicular muscles. So you have here the superficial muscles, and here you have the deeper ones. For the superficial one, this is the deltoid muscle, and the deltoid muscle is responsible for flexion, abduction, and extension of the shoulder joint. Okay, flexion, extension, and AB or abduction. Pectoralis major is responsible for flexion, internal rotation or medial rotation, and adduction of the shoulder joint. Serratus anterior is important for moving the glenoid cavity upward. So I will show you to you how does it work. Okay. The deeper layer, if you remove the pectoralis muscle and the deltoid muscle, then you can see deeper muscles. One of them is called pectoralis minor. So this pectoralis minor is important for protraction of the shoulder joint. Okay, protraction. And here you also have the subclavius muscle, that is for the depression, and pectoralis minor is also for depression of the shoulder joint. So, and then you have the some other muscles at the background. You have the subscapularis muscles. You have the teres major and minor is here, but I will discuss these muscles later on. Okay, you have the coracobrachialis and biceps muscles. These two muscles are, we will discuss it later, so this is not in the chest wall, it is for movement of the shoulder. Okay, so we discussed these two muscles already. So this is located, this muscle is called subscapularis, that is located in the subscapular fossa of scapula, which is the anterior surfaces of the scapula, anterior surface, and this muscle causes internal rotation or medial rotation of the shoulder. You also have the teres major here, but I will discuss teres major later, okay, when I show you the back muscles. You have the coracobrachialis muscle. This muscle causes adduction and flexion of the shoulder joint, and this is the biceps muscle that can cause flexion of the shoulder, but also cause flexion of the elbow. Some of these muscles also have some other functions, but I'm just giving you the big ones. These are the muscles of the back. So one of them is called trapezius muscle, really big muscle, superficial muscle of the back. It depends on which part contracts. It can cause extension of the neck, elevation of the neck, depression of the, elevation of the shoulder, not the neck, elevation of the shoulder, depression of the shoulder, or retraction of the shoulder. Retraction of the shoulder means moving the shoulder backward. So it depends on which part contracts, you have different movements. And this one is called levator scapulae. So obviously the name is obvious, it can cause elevation of the scapula. These two muscles are called rhomboid minor and major, that are attached to the medial border of scapula, and that can cause adduction of scapula toward the spine. And this is the serratus anterior, and the very important function of this is cause movement of the glenoid cavity upward. So in that case, if you want to reach a shelf, or if you want to raise your hand to ask a question, then you're using the serratus anterior muscle. Some other muscles that are here, and this is called the supraspinatus muscle. Okay, the supraspinatus muscle causes abduction of the shoulder, similar to deltoid. Deltoid is a bigger muscle, supraspinatus is a smaller muscle. Both of them together cause abduction of the shoulder joint. So this is located in the supraspinous fossa, if you remember the scapula. And this muscle is called infraspinatus muscle, and that is located in the infraspinous fossa of scapula. This muscle with teres minor, both of them cause external rotation or lateral rotation of the shoulder joint. External or lateral rotation. And this is called teres major. Teres major has the same function as latissimus dorsi, so it's really big muscle here. It's a superficial muscle. So both of them will cause extension of the shoulder joint, adduction, and internal rotation. Extension, adduction, and internal rotation. For example, if you want to scratch your back, so you have to use these muscles.